Hi, this is Dr. Bruce Houghton, and I wanted to talk to you about cat bites today in this video. I have one of our cats, Hermione, who's going to help out with the first part of the video. Now, Hermione is my wife's cat, Deborah's cat, and she's not really very fond of me. Now, she's never bit me, but she has scratched me a few times. So, the topic today is cat bites. Now, if Hermione actually were to bite me, that would cause a lot of problems, and we'll talk about those. Now, if she ever did bite me, we'd have to have a discussion about maybe going to the drop box at the Humane Society and not coming back home. Now, I know that would never happen. My wife would never let me do that. But Hermione, I think she's pretty much fed up with the first part of the video, so I'm going to let her go. So the objectives today, after the conclusion of the talk, you should be able to cite the common organisms involved in cat bites, utilize appropriate empiric antibiotic coverage for cat bite infections, and recognize the signs of tenosynovitis. Now, occasionally you'll see me glancing downward. I'm referring to my notes so they don't get lost during the rest of the presentation. Now, some animal bite statistics. Animal bites account for about 1 to 2% of all emergency room visits. Of those, dog bites are the vast majority, over around 80%. Now, cat bites are number 2 as far as the animal most likely to bite you, accounting for about 5 to 15% of reported animal bites. Now, the hand is the most common site bit by cats. About 45 to 63% of the time, if a cat's going to bite you, it's going to be on your hands. Now, the infection rate for cat bites is about 30 to 50%, and this is double the rate of what we see in dogs. Infective complications from cat bites account for about 1% of all patients who are hospitalized for hand infections. And this is due to the fact that cats are very able to get their jaws into you and get their teeth into you. Their teeth are very fine and sharp, and they penetrate deeply and can even hit the tendons and the tendon sheaths. Now, cat scratch disease is a separate topic. I wanted to just touch on it briefly because everyone's heard of cat scratch fever. Now, Bartonella is the gram-negative bacillus that accounts for cat scratch disease. Now, usually it's benign, self-limited condition in immunocompetent patients. There's maybe a 3 to 30-day incubation period, formulation of a small pustule or papule, and then development of some regional lymphadenitis. About 50% of patients will get systemic infections, and occasionally antibiotics such as fluoroquinolones will be required to treat this. Now, there are a couple patients I want to introduce you to who've actually had cat bites in my practice over the years. The first one is the photograph you'll see is a retired nun who is in her 70s. And I'm not really sure nuns retire, but she was living in a nursing home due to multiple medical problems, the most pressing of which was Parkinson's disease, which really caused her severe debility and inability to care for herself. Now, at her nursing home, they actually had a cat who was their pet, and one day it was sitting on her lap. Now, she was sitting next to a door, and someone closed the door, the cat's tail got caught in the door, and got frightened, had pain, bit down, and bit her on the left, on her right thumb there. Now, if you look at the photograph, you can see there's some swelling in the right thumb, and also an area where she was bit. And if you look closer, you can see that the thumb is quite erythematous and swollen, and there's streaking lymphadenitis going up the arm. Now, she presented about 24 hours after she was bit, and the people at the home actually cleaned her hand and did all the appropriate initial therapy, but she still developed an infection nonetheless. Now, we had to admit her to the hospital for a few days. She recovered easily with some IV antibiotics.